Thank you to the Community Foundation for inviting me to speak to you today about the impacts of the pandemic on community and household food insecurity in Medicine Hat. Many people probably thought that the pandemic threw a wrench into a smoothly running food system, but in fact what it did was reveal weaknesses already existing just below the surface. First, we need to make sure that we are coming from a shared understanding of terms. Household food insecurity is typically defined as the inadequate or insecure access to food due to financial constraints. Those financial constraints can prevent the purchase of food, the ability to travel to purchase food, or put people in a quandary of which to put their limited funds towards, the purchase of groceries, or the cost of the transportation to go and get them. The pandemic has not only increased the rate of household food insecurity, it has also increased our awareness of our food system and the challenges we face as a community in having a reliable, safe, and accessible food supply. In addition to households with food insecurity, we now have the broader community experience food shortages that don't have a financial origin, which is community food insecurity. Did you find that you were struggling to figure out a way to safely purchase groceries and get them to your home those first few weeks of adjustment in March 2020, before curbside pickup, delivery, and online ordering became the norm? This is a pre-pandemic everyday occurrence for many people in our community who possess neither the physical nor economic means to obtain groceries for their households. The pandemic made people more aware of the challenges that face many in our community every day. It's fortunate that we have created an information sheet on the existing delivery options for our local grocery stores as part of our Healthy Eating on a Budget class. That document was shared many times that first week and made the rounds on the city website, Medicine Hat News, and was distributed out through Alberta Health Services, Children's Mental Health, and the school districts. Suddenly, many people in the community were realizing that physical access to a grocery store could be complicated, not only for financial reasons. Then we started to experience food shortages. Companies had reduced workforces and chose to reduce their processing to only their top sellers. People were at home and wanting to bake, but there was a flour shortage. Here we are, sitting in the middle of an agricultural breadbasket, and we couldn't purchase flour. We grow grain, but have no way of processing it locally. This is another example of a food system or community food security issue that affects everyone, regardless of income. Those early weeks were hard. We were all flying blind, trying to figure out what we were up against, learning to be nimble and pivot, all while trying to figure out Zoom. We had to shut down our Good Food Club for a couple of months while we figured out protocols. It was so frustrating for me to see the increased need in the community and not be able to offer programming, which involves an important element of community development through volunteerism and social interaction. I applaud the Food Bank and Mustard Seed, as well as the various hot meal programs around the city, who work tirelessly to continue to provide emergency food to those in need, often without their dedicated volunteers. Once we got through the flour shortage, we arrived at gardening season, and people who had given up gardening in years past or had never done it before were now eager to start growing their own food, as we all felt uncertain about the future and had a little less faith in the supply chain than we had before. Stores, nurseries, and seed houses were sold out. Our community gardens were full with a lengthy wait list. We were so grateful for the Community Foundation for the funds to offer vegetable container gardening kits that were distributed to 35 households through Bridges Family Services. Those kits included a selection of fresh vegetables and herbs to supplement the food that was being obtained in other ways. We wanted to provide a low-stakes, high-reward new gardener learning opportunity, which these kits made possible. With minimal experience or work, people could harvest tomatoes, lettuce, herbs, and carrots, and perhaps catch the gardening bug. During the summer of 2021, again with the financial support of the Community Foundation, we expanded the vegetable container gardening program. 39 kits and soil for an additional 14 grow tubs went to Bridges Family Programs, 50 kits to Samus Immigration, 30 kits to McMahon, and 8 kits to Elm Street school families. All this working around facility access and transportation issues inspired the investigation and beginning stages of planning for a mobile, low-cost grocery in our community. In December of 2020, we distributed a community-wide survey to determine how much of an issue physical access to grocery stores was in Medicine Hat. We had almost 300 respondents, and of that, 23.5% reported that the time it took to travel or walk to get groceries limited them from going as often as they needed to. 43% of respondents stated that they had difficulty making ends meet at the end of the month, either often or sometimes. In summary, while we know that all of our citizens have been and continue to be impacted by the long and international supply chain, lack of local processing capacity, and to some extent, COVID restrictions, individuals who also lack financial means to help them overcome these additional barriers have a much greater challenge. In pre-pandemic 2019, the Medicine Hat Food Bank served 1,472 households. Unfortunately, studies tell us that only about 20% of severely food insecure households actually access food banks. That means the estimated number of severely food insecure households in Medicine Hat could be 7,360, which is approximately 12% of our population. Even if everyone who needed food was successful in accessing a food bank or soup kitchen, we know that the uncertainty of a consistent, appropriate, and accessible food supply causes great stress on individuals and households. In turn, this translates to many individuals with increased risk of chronic disease, illness, mental health concerns, poor growth and development in children, family breakdown, and unemployment, just to name a few. So where do we go from here? We know that physical access goes hand in hand with economic access. We know that having the funds and transportation to access food makes no difference if that food is unavailable in our area. We hope that people's experience over the pandemic has increased the general population's understanding of how important local food production and short supply chains are to providing community food security. We can support local food producers. If we have increasing demand for locally grown and processed food, we will see either increased or expanded local production, as producers can be assured of a guaranteed market and can expand their operations with confidence. Collectively, we can and should advocate for policy changes and social supports that prevent household food insecurity, reducing the demand for emergency food access. To look at more long-term root cause solutions, CFSEA is looking at developing an interagency committee to determine policy advocacy and community action to achieve the goal of reducing food insecurity in and around Medicine Hat. If you or your organization is interested in participating in this work, please contact me.
Hi there, my name is Hannah Cook and I work with Bridges Family Programs. I have a message that one of our participants, who's also participated in lots of the Community Food Connections programs, has sent that she would like to share, so I'm going to read that for you. She said, I really appreciate all that Community Food Connections does for the community. They do a lot. I've used quite a few of the things that they ran, such as the Good Food Box, the planter boxes that they've set up, as well as some of the community kitchens, such as canning. That was fun. I really appreciate the support, especially when times have been tough, but it has helped with mental health as well, because some days I just don't feel like cooking, and having the ready-made meals from the community kitchens on days that I was having good days helps a lot as well.